Hi YouTube, it's Courtney or VSG Redesign Me. I know you've probably forgotten about who I am, but I figured I'd come to you with my month 16, 15 vertical sleeve gastrectomy update. I'll talk a little bit about WLSFA, what I've been up to, my weight, because I'm sure you all care. And I have an announcement at the end. I'm going to leave it until the end. Some of you know, some of you don't, and we'll go from there. So I had surgery on January 7th, 2015 at Hudson Valley Hospital Center, which is now New York Presbyterian in Peekskill, New York. My highest weight was 345 pounds. Last time I came to you, I was somewhere in the 200s. Right now I'm 197-ish, give or take. So I did hit Wonderland. I don't think I made a video about that. I did post about it on Facebook, but it hasn't been something that I've really been monitoring that closely, to be totally honest. I weigh in once a week. I do what I have to do. I'm not working out as much as I should be, so I'm happy that I haven't gained anything. I haven't lost anything. It's been a pretty trying 6 months, give or take, so I'm really happy that I've managed to stay where I've been. I bike ride every once in a while. I don't go to the gym at all, which is really bad, but it is what it is. My schedule's crazy, and that's not an excuse, but in this case, it's a bit of an excuse. I try to keep my food on point. I eat the same crap every day. It's probably why I don't gain any weight, because I'm not really doing anything special. I get some protein in, I get vegetables, I get some carbs. I brought carbs back into my diet. That was a little hard to acclimate to for a while, so I'm slowly getting used to that. What else? So, the reason why I'm making a video is because everybody kind of gave me shit for not making videos for a while, and I haven't made any updates, so here I am. I got back from WLSFA on Sunday morning, afternoon, and I've just now finally gotten to the point where I feel like I can sit down and make a video after processing everything. This was an interesting event for me particularly. As you know, Tara is no longer here living with me, so that was trying, and part of the reason why I took a break from making videos and doing a lot of updating in the community, because I just needed time to process and figure out who I was, singularly, I guess is the best way to describe that. But she did come to WLSFA, and there was a lot of anxiety for, I think, both of us surrounding that, but it was good. It was good to sit down and hash it out and have a neutral zone for both of us to kind of come to terms with where we were in terms of our relationship and friendship and how that was all making sense for us. So there was definitely a lot of anxiety for me going into this trip, a lot more than any other meet and greet, because I was at WLSFA last year and I went to OH, and then I've had some weight loss surgery encounters outside of meet and greets, so this was definitely the most anxiety ridden, just for personal reasons. It had absolutely nothing to do with the organization or anything. So let me talk about that for a second. WLSFA, I'm sure everybody knows now, but if you don't, it's the Weight Loss Surgery Foundation of America. They give grants to weight loss surgery patients that are potential weight loss surgery patients that otherwise couldn't afford the surgery on their own through insurance or other means. It's a very good organization, and they hold a conference every year. The conference was excellent. I thoroughly enjoyed myself. From what I heard, a lot of the sessions were very helpful. I only went to a few. I went to the second YouTube panel with Liz and as the moderator, and then I went to Sarah Waffles goal setting session, which I thoroughly enjoyed, although I think at that point I was probably emotionally wrecked. So thinking about my goals for the next year that was a bit difficult for me. I'm always impressed with how they manage to pull off these events, and I'm always impressed with how many people show up every year. It seems like every year it gets bigger, and just from what I watched the year before I went, and then last year when I went to San Diego, and this year there's definitely been a lot of growth in terms of attendees, and it's awesome to see what they're actually doing. But I'm not going to really waste much time talking about WLSFA in this video just because you've heard all the videos and my sentiments are exactly the same. I will say that it was definitely probably a lot more of an emotional trip for me than I had anticipated. It wrecked me for like a week afterwards. Like I'm just now starting to recover and I'm exhausted right now. Like I'm in my bedroom and I'm going to go to bed after this. But I wanted to come on and make a video because I said I would, and I also wanted to announce a few things and, go from there. So, what else is going on? With WLSFA, I had a lot of fun. I, spent a lot of time with people. I'm not going to name names. Just like everybody else, it was, if I spent time with you, I meant it. If I talked to you, if we had an emotional conversation, and there were a few of you that we did, you know who you are, and I appreciate it, and thank you very, very much for being there for me. Thank you for being there for Tara. One thing I will say was that I did get to meet less of Sarah, which I had never met before, and it was really good to sit down and talk with her. She gave me some perspective that I needed on having a past significant other in the community, and that really kind of helped me wrap my mind around some things. Obviously, it was a personal conversation, so I'm not going into detail, but just that is my one shout out is thank you for helping me kind of understand a different perspective than my own, I think is what I'm getting at. So, it was last year I went to every single freaking session that I could go to. I didn't do that this year. Honestly, I spent most of my Friday at the pool and I hung out with a few people, and then we went to country night, and then I was with the group that went out to Crazy Town on Friday night. It was a huge experience for me. Again, there was no drama, and you'll hear that over and over again. It was a very cool night. It was just relaxed. I got up on a stage and danced, which is totally not my style. So that was a huge NSV for me. So much stuff happened. I love everybody that was there, and I will say this and I'll say it again. It's just 2 a.m. and after, no good comes from that. So that was a good night. And then on Saturday, I was kind of wrecked. That was a very long and very extroverted night for me. So Saturday was definitely a lot lower key for me. I kind of started late, and then I didn't go out to Lipstick that night because I had my flight was ass early. I think it was I had a 7 a.m. flight. Like my flight left the gate at 7 a.m. So I was in bed pretty early. Cece and I went out to dinner, and then we just kind of went back to the room and then crashed. I packed and I got everything ready and we went to bed. Overall, it was definitely the best meet and greet I've ever been to, all things considered. My anxiety was warranted, but it was relieved towards the end of Saturday, I think. It took a little while for that to go away. There was definitely a lot going on internally for myself this trip. So it may have seemed, if you met me, that I was a little kind of funky. That's because I was, and I apologize. I didn't mean to seem offstandish or dismissive of anybody. I was just kind of in my own world for this trip. What else? So I left on Sunday, I came home, I crashed. I came home and I just completely, I was done for the rest of the night, or day actually. And then I went to bed early and I've just been absolutely insane all week long. I've been meaning to make this video for a while now and I just haven't had a chance because I've been so busy at work. And I don't know if you know much about New York, but I travel to New York every day, and the Metro North had a huge fire, which meant there was a whole bunch of transit issues for me, and I had like a 4-hour commute coming home one night. So every night I planned on making a video. Something stood in my way, and I was stuck transit or in a car doing something stupid that I shouldn't have been doing on my normal week. Um, Other news is I graduate in 2 weeks for my graduate degree, so that'll finally be done. But the big news that I have, if you've stuck around with me this long, is that I've made the decision to have my plastic surgery. This is a huge decision for me. It's been going on for a little while now. I was very quiet about it. I didn't talk about it a lot. I told a lot of people for the first time at WLSFA, and thank you if you sat down and talked to me about plastic surgery, especially Patty and Tanya briefly. I did talk to you guys, and I appreciate it. And I talked to Amy a lot. It's funny, Amy gets a VSG, who is now Amy gets a 360. And I are surgery sisters. We had our surgeries a week apart originally for our VSGs, and now she's having her surgery. I think it's on August 10th, and I am having my surgery on August 25th. So I am planning on having a breast lift, no augmentation, and a tummy tuck. I'm not having an extended table tummy tuck. I'm not having a 360. I don't need it. But I do have some overhang that needs to be taken care of. I found an excellent surgeon, board certified in New York City. So I'm going to go and have a day surgery with him, and then I'm going to stay 2 days in New York City before I head home, and then I'll be from home for like 3 weeks. I'm going to start making videos about my plastic surgery, what I'm deciding to do. I'm also having the abdominoplasty, abdominal wall, and I'm having some liposuction done. It was a hard decision for me to make because I do want children, but I'm struggling right now with some issues with my breast. Before I had weight loss surgery, I was around a 46, probably E. I could have been in an F in some bras. My breasts were massive. I still have fairly large breasts. I sit in a 38 triple D, but that's only because if I go down to a 36, which is my actual band size, my boobs fall out of my triple D. So I'd have to get custom bras. The biggest issue for me is that I talked with the surgeons and I have grade 3 ptosis. Ptosis is the amount of sag in your breast. It goes to grade 4. My breasts hang extremely low, and I'll do a video to explain and show all the nasty. But the issue is that all of the tissue that I have left is hanging in the bottom portion of my breasts. So they're bottom heavy and they yank on my chest wall and all of the tissue in my nipple, like around my nipples, and it causes extreme pain for me. So when I take off my bra at night, I end up having to hold my breasts in place for a few minutes before I can let them drop, just so that they can get used to gravity again. It's a big problem. So I had originally gone to the plastic surgeon to talk about just getting a breast lift and possibly some reduction. And while I was there, he recommended doing the tummy tuck too. Depending on the surgeon you talk to, and I talked to a few, they either recommend not doing the tummy tuck until after or just going and getting it done because of the amount of weight loss I've had. 150 pounds almost lost at this point. My skin is pretty rough. I still have a lot of fat in my stomach area, but I also have a lot of loose skin, and it's starting to cause issues in my overhang on my belly button area. I'm starting to get rashes, and I'm worried that as the summer progresses, it's going to get worse. So that's been a concern of mine as well. So I had them code out both, and it ended up being more cost efficient to do both now than to wait and do the tummy tuck later. So I'm going to just do it now while I have the time, the money, and the means. I don't have children, so I don't have to worry about taking care of anybody. I have the time off. I work for a very flexible company, so I can make sure that I'm still available to work, but I have time to work from home. So it's just a good time for me in my life to do it. It's not necessarily something that everybody that hasn't had children should do, but with the amount of weight loss I've had, it just makes sense. Some people asked me, like, why am I not doing the 360 after this much weight loss? The plastic surgeon pretty much told me that he didn't feel as though doing a 360 would get me the results that I want. Um, in comparison to the amount of pain that I would have to go through for the results. So he said that the results would be limited in terms of improvement in my back and my ass and my thighs, and that he doesn't think that it was worth the pain and the risk of the surgery to have it done. So I trusted him a lot in that because I had other surgeons quote me with it, saying that while I didn't need it, it would give me the best results, and I'm not really looking for this, while it is cosmetic for me, it's really more about just being comfortable. So the tummy tuck was an added benefit. It wasn't so much that I felt uncomfortable with my stomach or my butt. So the 360 just seemed like a lot of extra money and effort for minimum results when I'm not completely unhappy with how my body looks in clothes anyway. So the tummy tuck will at least help with the rashes, and it'll help with I'm having issues with my pants right now where it always looks like I have a perpetual like muffin top, and I'm constantly wearing shapewear just to take care of that. So as long as I can get rid of that and I can get rid of the rash issue, I'm happy. I don't have significant sag in my butt or in my thighs that I feel like I need to go through that extra step just for some minimum improvements, because at the end of the day, the best improvements that I'm going to get is a thigh lift, and that just sounds horrific to me. The breast, though, I was going to do that either way. So I had asked if I needed a reduction or an augmentation or just a lift. They said that if they do just the lift, I will walk away with a 36 triple D. They could do a reduction and bring me down to a double D, but he thinks that I would have really great results if I just kept all of my tissue, that I would look like I had a full breast implant, and I would look very well rounded. I think that's what I'm going to go with. I haven't quite decided whether or not I want him to do the reduction. That's in my cost, so either way, I can do whatever I want. I'm going to talk to him again in July, and I'm gonna have him go through the plan and do everything that needs to be done in terms of pre-op visits, and I'll go through that in another video. But overall, I'm really happy with my surgeon and the choice, and I'm excited for this next step in my journey. So I just wanted to say hi, and this video is already 18 minutes long, so I'm gonna go for the night, and I'll be in touch soon with some more plastic surgery updates, and hopefully this is going to be helpful for people who are maybe at this point and deciding whether or not they want to have plastics. I know there's a lot of other people right now going through it, like Lauren Dayton's going next week. Amy, and I know VSG Granny is deciding to go with a surgeon that actually is at the same office as the surgeon that I'm having done. So that's about it right now. I hope everybody's doing well. It was great seeing you. If I saw you, if I didn't, I hope to see you soon. And thank you, and have a good night, everybody.